Hey guys, Dr. Cody here with some more stretches and exercises. This time I'm trying to help out with low back pain, hip pain, piriformis syndrome, any pain traveling down your legs. So here's a few stretches exercises that you can incorporate into your care to help you get a little bit better. The first one we're gonna do is pretty simple, pretty easy. You can do this on the floor or if more comfortable in your bed if you can't get down on the floor. It's gonna be a knee tuck. So we're gonna lay down and we're just gonna pull our knee back to our chest, holding for a little bit through here. And then we're going to switch. Again, we're aiming to hold this for about 30 seconds if you can. I'm going a little faster just for the demonstration, but you want to really feel this deep stretch on the back side of your glute muscle. Another version of the stretch is a figure four. So for this, we're going to cross our legs over, making a figure four pattern. We're going to reach behind our leg, interlacing our fingers, and then we're going to gently lean back. As we do, we're pulling this leg back, and the knee that's bent in that 90-degree angle is going to be the one that's experiencing the nice stretch. And then again, we can just rock back up and we can switch, crossing the other leg over, pulling through here and coming back. Again, try to hold this for about 30 seconds or so, feeling that nice deep stretch into the hip. The next version that we can do to kind of increase this stretch is going to be doing a 90-90. So the 90-90 stretch, what we're going to do is we're going to get our front leg out into this 90-degree position, and if you can, getting the back leg into a 90-degree position. I like to take one hand and put it kind of on the ankle here. You can put it on the floor or in front, but I just find it more stable for me to put it on my ankle. Other hand coming out to the side. What we want to do is get into a neutral spine. So we don't want to be extended, and we don't want to be rounded coming through. So I like to kind of just move back and forth until I feel that nice neutral spine. Next, I'm going to actively push the outside of my leg into the floor. Driving it in, you're going to feel your hip rock forward. And then from there, keeping this neutral spine, I'm going to bring my chest over my knee, feeling this really good stretch on this forward leg through here. Again, holding for about 30 seconds or so. You can even rock in and out of that stretch. And as you get more comfortable, get more flexible, keeping the neutral spine, you can try to get even lower. Now, what's really cool about this is that we can incorporate a little exercise into this as well. We're going to work on some rotation in this back leg. So now we're going to relax the front leg. I don't need to be pushing actively into the floor. I'm going to use this guideline on my hip here. What we're looking for is just for the knee to lift off the ground and get hip external rotation. I don't want to rotate my spine. So this keeps me from doing this and opening up my chest to the exercise. So again, we're going to keep down through here. I'm going to lift the knee, keeping the foot on the floor. Should feel really good to get some movement into this hip. Doing about 10 to 12 rotations, or if you want, you can even set a timer for 30 seconds as you go up and down. But try to get a little bit further with each lift as you go through. After you completed that side, we can switch to the other. Same thing, getting this 90-90 position, anchoring ourselves, getting into a neutral spine, and leaning forward. You may find one side's tighter than the other. That's fine. Just spend a little bit more time getting into that depth of that exercise. Again, when you're doing this, actively push down on this front leg. Then we'd come back out, relax, have our guideline, and we do our external rotation. It may take a few movements to actually get the movement down as you're coming through. You can also hold the end range a little bit longer if you'd like as you come through the exercise. Next one is going to be a little piriformis stretch that we can do on a bench or a table. So it's going to be very similar, getting that bent knee. This is also called a pigeon stretch. So you're going to come through here, bringing the leg up to bend, having our hands planted on the bench, and then we're going to sink down. The first part of the exercise, the stretch, is just getting our hips down below the knee, keeping that nice neutral spine. This should feel pretty good. And if this is as far as you can go, this is a fine way to get a stretch into that back glute. But if you can, add in a little bit of a lean forward, you're going to feel that stretch even more intense. And again, we repeat that on the other side. Now, a couple muscles that we need to work on strengthening are going to be our piriformis and our glute medius. There's a couple ways we can do that. First one is going to be the most easiest. It is going to be a clamshell. So laying on the floor, get into a nice comfortable position. We're going to have our knees bent and our feet stacked on top of each other, keeping one hand on the hip again as our guideline. What we don't want is we don't want to roll off the floor. We want to make sure that we're staying nice and compact and just lifting the knee up. As we do this, we're going to hold at the top for a count or two and feel the upper outside of our hip engage. You can start by doing about 10 to 12 reps of these for 3 rounds. And again, you'd flip and do the other side as well. When this gets easier, we can transition to a straight leg raise. I call these the Jane Fondas. And for this one, we're going to lift the leg straight up. Hold for a count or 2 and come back down. Again, we don't want to roll. We're trying to stay right on top and just lifting the leg straight up into the air. The goal for this is eventually to progress to 50 repetitions on each side. And if you can do these hover reps. What that looks like is you're going to lift up, you're going to hold for 2 seconds, and then as you slowly lower down, you're going to keep your foot above the other foot and hold for 2 seconds. This keeps the muscle under tension for longer, so it makes the exercise a little bit more challenging. Again, eventually trying to get to 50 repetitions. The next one is going to be a funny one, but it actually works really well for the piriformis, and it's called the fire hydrant. And you'll see why. So you're going to come down into tabletop position. We're going to engage our core, right? So that means we're trying to pull our belly button back to our spine and lock everything in nice and sturdy. From here, we're going to lift one leg up to the side like a dog with a fire hydrant. Again, we're just trying to lift the hip out, hold for 2 seconds, and come back. We don't want to roll or turn our spine. We want to try to keep everything neutral and just lift the hip. Awesome. And then the last one to really strengthen this glute med, you can use a band. There's a couple ways you can do this. You can do it in a kind of like an X position or a square position where you're holding the band up like this. Or if you want a little bit more intensity, you can take a shortened band and place it just above the ankles. So over here, I'm going to get the band into full tension. I'm going to come down into just a little bit of a squat with bent knees, and I'm going to do some ladder work. So from here, I'm going to take a step out to my left and not let this band pull me in, keeping my foot locked out as I come back. Then I'll do 1 step to the right. Next, I'll do 2 steps to the left. And 2 steps to the right. You repeat this going 3, 3, 4, 4, all the way to 10 on each side. And it's the right one to burn out the glute meds and really help strengthen these muscles. So give these a try when you're experiencing some back or hip pain and see how it helps you get your journey.